Yes, hi, hello everyone. Yes, Girish GT. Good evening, Girish. Vandana Singh. Vandana Singh. Vandana Singh. Okay, Vandana, you just remind me at the end. Yes, Girish GT. Yeah. Okay. So let's start. So this is a short session related to the most important diagrams that can be asked in your tomorrow's exam. So the most important diagrams, especially in neuroanatomy and in entire paper 1 of anatomy. Yes, Shashank Puja, Pratik Desai, Vandana Singh. Yeah. So don't stress. Do your best. Forget the rest. So stress definitely it will be there. Do your best. So don't worry about the percentage. Don't compare with others. Do your best and forget the rest. And forget the rest. All of you. Okay. Shashank. Hmm? Yes, Shashank. Be positive. And in the beginning, some important general instructions related to tomorrow's exam, especially for the RS7 students. So, this is the answer sheet that is given by the RGUHS, and it is clearly mentioned the only the dark blue or the black pen is allowed, no other color, not the light blue, not the red pen, not the green pen or any other color. So only dark blue pen or the black pen. You can use color pencil for diagram. Okay. Yes. Chalo. And as you know, 9 o'clock is the exam. You need to be there at 8:30 in the examination hall. So because there will be some paperwork. So you need to fill all the details. So details of examination, the question paper code, your register number, the date of examination, subject, the paper 1, paper 2 and all. You need to write in the beginning properly. And so this is how you need to write. So as you know, the answer sheet will be scanned by the computer. Scanned by the computer. That's why it is better to use dark black pen. So do not enter any stray mark. Need to write about the QP code. As you know, QP code for RS5, RS6 is different. The QP code for RS7 that is different. Yes, RS4, what is the QP code? Shashank Pujar. Shashank, what is the QP code of RS4? Yes, Shashank. And what is the QP code of RS7? Can anyone message me in the chat box? So tomorrow's QP code, question paper code, it differs from RS5, RS6 to RS7. Can anyone message me? What is the QP code? Yes, Shashank Pujar is telling, sir, 1020 for RS6. So for RS6, it is 1020. RS7, Pratik, RS7. So Likit Balakrishna, it is 1020. For RS7, I think it differs. Right? Can anyone message me? What is the QP code of RS7? QP code of RS7? Okay, 5501. So 5501 for RS7. Okay, 55001. Okay, 5501. Okay, that's fine. And one more common mistake the student do after the exam, that is, do not forget to tick the answered question. So do not forget to tick the answered questions. So in the top of the answer sheet, so there will be the question numbers. You need to tick the number of question answered, number of questions kept blank. Okay. Yes. Then one more common mistake here. So let's see. Okay, do not write anything on the answer sheet other than the answers. So don't write anything other than the answer. So don't try story. Don't try story to fill the pages. That will not be corrected. So anything that is written anatomy, it will be corrected. Anything other than anatomy, they will not correct it. Write answers near the given question number 1. This is very important. This is very, very important. Write the answers near the given answer question number only. Okay. So question number 1, 2, 3, 4, 5 up to 22 question number ಕೊಟ್ಟಿರ್ತಾರೆ. ಆ ಆನ್ಸರ್ ಶೀಟ್ ಏನು ಕ್ವಶನ್ ನಂಬರ್ ಇರುತ್ತೆ ಅಲ್ಲೇ ಆನ್ಸರ್ ಬರೀಬೇಕು ನೀವು. 1 ಅಲ್ಲಿ 1 ಆನ್ಸರ್ ಬರೀಬೇಕು, 2 ಅಲ್ಲಿ 2 ಆನ್ಸರ್ ಬರೀಬೇಕು, 3 ಅಲ್ಲಿ 3 ಬರೀಬೇಕು. ಕೆಲವರು ಏನು ಮಾಡ್ತಾರೆ 3 ಅಲ್ಲಿ 4 ಬರೀತಾರೆ, 4 ಅಲ್ಲಿ 5 ಬರೀತಾರೆ, 5 ಅಲ್ಲಿ 6 ಬರೀತಾರೆ. ಸೊ ಆ ಥರ ಬರೆದ್ರೆ ನಿಮಗೆ ಮಾರ್ಕ್ಸ್ ಸಿಗಲ್ಲ, 0 ಮಾರ್ಕ್. ಸೊ ರೈಟ್ ಆನ್ಸರ್ಸ್ ನೀಟ್ಲಿ ಆ್ಯಂಡ್ ಲೆಜಿಬಲಿ. So the good handwriting, definitely very good. Do not use color pens. Our average handwriting is also okay. So do not use color pens. So you can use color pencil, not the color pens. So don't use the red and green and all. Answer all the required number of questions. Underline headings. So this is important. You need to underline the headings. So yeah. No additional will be given. So this point, no additional sheets will be given in the exam. Write answer in points. Write answer in points. Like example, cerebellum. What are the lesions or what are the features of cerebellar disease? You can write 1, 2, 3, 4, 5, 6 like that. Cerebral ataxia, intentional tremor, and all you can write. Okay. So write in not in the paragraph. It is better. Use pictures, flowcharts wherever necessary. Wherever necessary. Okay. And one more thing, my suggestion, don't leave any question. Don't leave any question. Write something related to that. Write something. Maybe applied aspects, maybe clinical features, or some relations or definition. You can write. Don't leave any question blank in your exam. So you're getting my point, Navya, Shashank Pujar, Santosh Kasar. Yes, Shashank Pujar, all of you write. So, okay, just tell me. So, you are getting my point or not? Don't leave any question. Okay, don't leave any question blank. Okay, just type in the. Okay, just type in the chat box. So, don't leave any question. Just write. Don't leave any question. Write this in chat box. So, don't leave any question blank. Don't do that. Pratik Desai. And our offline students, Pratik Desai, Shashank Pujar, and Manthan, Sharan. So attempt all the questions. Write something something about the question asked. So you will get at least 1 mark, at least 1 out of 5, like that. Okay, so this is one advice from my side. Try finishing your exam at least 15 minutes before. 15 minutes before. Definitely it is not possible, as you know. So, and I said, especially RS5 and RS6, you can start with the short answers. This is RS5 and RS6. You can start with the short answers. The short answers, maximum 45 minutes. That is 9:45 a.m. So by 9:45 a.m., you need to complete all your short answer. So 9:45 is the deadline of time. Then comes, you can write short essay. There will be 8 short essay. This you need to complete by somewhere around 11 a.m. 11 a.m. So the deadline for your short essay, that is 11 a.m. This is for RS5 and RS6, not for RS7. So then long essay, that is around 11:30. Then you can attempt your MCQ, that is around 15 minutes. 15 minutes. So this is how you can schedule your answer sheet tomorrow. Okay? Getting my point? Neerak, Kirti Kumar? Yes. Kirti Kumar. So Neeraj, we discussed yesterday. You can go through previous videos, 3 or 4 videos. We discussed all important long guesses that can be asked in your basically neuroanatomy. We discussed. You can go through that, Neeraj. Okay, Kirti Kumar. Okay, hello. That's fine. Yes, yes. Good, good. Hello. And ID card, hall ticket, ID card, hall ticket, important. And is very important, that is basically, this is very important. Don't skip your breakfast. Don't skip your breakfast. That can lead to hypoglycemia. Hypoglycemia can affect your performance. That's why have some light breakfast. Idli, sambar, idli, chutney, that is fine. Have some coffee or tea around 8:20, 8:50, 8 o'clock, just coffee, tea. Okay. So this is important. Okay. Breakfast. Hello. So this is about the general instructions. Now we are going to discuss about discuss about discuss about discuss about some important image based questions, some important diagrams that can be asked. So this is asked more than 3 times in last 5 years. Transverse section of midbrain at the level of superior colliculus. So write the diagram of transverse section of midbrain at the level of superior colliculus. So as you know, superior colliculus, it's a very important component of visual pathway. Visual pathway. So midbrain at the level of superior colliculus. Midbrain at the level of inferior colliculus. Or the medulla oblongata at the level of sensory decussation. Spinal cord, commonly asked. Okay, label diagram of that. Or upper pons and lower pons. So this can be asked in your exam. Santosh Kasar. Fine. So this is the diagram you need to practice. So you need to mention. So this is the superior colliculus. So the question is about superior colliculus. Superior colliculus visible. Then nucleus of third now. Third is nothing but oculomotor now, which supplies extraocular muscles, including levator palpebrae superioris, except lateral rectus and superior oblique. Also need to mention about corticospinal fibers. Corticospinal fibers, and very important is red nucleus. So when question asked about superior colliculus, you need to label red nucleus, medial lemniscus, periaqueductal gray matter, rubrospinal tract. At least there should be some 8 to 10 labeling must be there in the answer sheet. So this is superior colliculus, very commonly asked, frequently asked in the exam. Label diagram of superior colliculus. So there is a mnemonic for that. If you want, you can write the mnemonic. So mnemonic for remembering structures at the level of superior colliculus. So the mnemonic is SRO, CMC value. SRO, CMC value. S for superior colliculus. R for red nucleus. R for red nucleus, which is highly vascularized. Oculomotor nucleus. Corticospinal fibers. Medial lemniscus fasciculus. Crossing of superior cerebella peduncle. So I'll have to write in the chat box SRO CMC. SRO CMC. The structures visible at the level of superior colliculus. So write this in chat box. Keep writing guys. So Milan are reasoning questions of thorax. So Milan, I think yesterday we discussed few questions. That is referred pain in case of heart attack. Then heart attack in old age has better prognosis than the young age. And superior mediastinal syndrome and all. Okay. Yes. SRO SCMC. Likit, okay. SRO CMC. Just don't forget S for superior colliculus, R for red nucleus, oculomotor nucleus, corticospinal fibers, Amalfi and MLF, sorry, crossing of superior cerebellar peduncle. So this is very important. Let's see inferior colliculus. So this is again one more important question. Second question. Transverse section of midbrain at the level of inferior colliculus. So as you know, inferior colliculus is very important in auditory pathway. Auditory reflexes, auditory pathway. Auditory pathway. This is the diagram you need to write in the exam. So this diagram. Okay. So you can see the inferior colliculus. The inferior colliculus. Trochlear nerve. That is the fourth cranial nerve. Cerebral aqueduct. Periaqueductal gray matter. The nucleus of trigeminal nerve. Trochlear nucleus. Corticospinal corticonuclear fibers. Tectum, tegmentum and crus cerebri. Crus cerebri. Substantia nigra, which is a component of basal ganglia. Medial longitudinal fasciculus. Decussation of superior cerebellar peduncles and all. So you need to write at least 10 labels in the exam. So labeling is important. So writing diagram without labeling it is of no value in exam. Okay, Kirti Kumar, very important. You just go through this. Inferior colliculus. A mnemonic is there for that. I took my cat playing chess. Very funny exam time. I took my cat playing chess. I, that is basically for inferior colliculus. Took, that is a trochlear nucleus. Cat, that is medial longitudinal fasciculus. Cat, okay. Cat, that is playing, and also crus cerebrae. And again P, that is periductal aqueduct and crossing fibers. So all of you write in the chat box this mnemonic. I took my cat playing chess. Just write. So the last minute memory is very important. So keep writing. So I said the very important question is at the level of supracolliculus. Very important. Mnemonic is SRO CMC. And the second one is infracolliculus. The mnemonic is I took my cat playing chess. So these are two important diagrams very commonly asked. Yes, Pratik. Pratik, good. Likit. Now, one more very important question, repeat question. You must be knowing Likit Balakrishna, Pratik Desai, Shashank Pujar. Label diagram of transverse section of medulla oblongata at the level of sensory decussation. At the level of sensory decussation, you must practice one diagram. This is probably very important question. This can be asked in your tomorrow's exam. At the level of sensory decussation. Okay. Charan, yes. Okay. Charan, you are there? Fine. That's great. So, okay. Whenever asked, the question asked about sensory decussation, I remember two important nuclei. One is fasciculus gracilis. And cuneatus. Then nucleus ambiguous, hypoglossal nucleus, okay, inferior olivary nucleus, posterior sinus parabollar tract. So this is very important. So just you can take the screenshot of this and you can just go through this just before the exam. This is at the level of sensory decussation, especially for RS5, RS6. They ask one question that is about label diagram, the 5 mark basically. Yes. And again there is a mnemonic for that. RIP CMG. There was my friend in my UG MG, okay. So RIP CMG. RIP, rest in peace CMG, don't mistake me. RIP CMG, the mnemonic at the level of sensory decussation. So R for reticular formation, internal arcuate fibers, pyramids, nucleus cuneate, nucleus gracilis, medial lemniscus. So all of you write in the chat box. RIP CMG. So 3 mnemonics, try to memorize. Okay, very commonly asked. Keep writing, Charan. Pratik Desai, Likit Balakrishna. Keep writing. Okay. Then one more frequently asked question, that is lateral ventricle, third ventricle, and the fourth ventricle. Very important. The floor of fourth ventricle. So we discussed many times in our offline classes the floor of fourth ventricle. So what is the shape of the floor of the fourth ventricle, Pratik? What is the shape of the floor of fourth ventricle? So important questions are lateral ventricle. Very important. So just go through the diagram. Lateral ventricle, third ventricle, fourth ventricle, and the floor of the fourth ventricle. So these are important questions, very commonly asked in the exam. Okay. Yes, Pratik. Rhomboid shape, excellent. So Pratik, Very good, Pratik. Pratik, Manthan, Charan. Great. Okay. Rhomboid shape. The shape is rhomboid. Very good. So, and also try to memorize this image. So, the CSF flow, CSF, cerebrospinal fluid. So, that is formed in the quad flexus, MCQ, quad flexus. From there, it enters into the lateral ventricle. From lateral ventricle into the third ventricle, foramen of Monro. Foramen of Monro. Very commonly asked. Then fourth ventricle, that is through Sylvian aqueduct. Sylvian aqueduct. Then through the foramen of Lushka and foramen of Magendie, it goes to subarachnoid space and it is get absorbed in subarachnoid villi. So this is very important flow chart and very important MCQ. Quad flexus, lateral ventricle, foramen of Monro, third ventricle, Sylvian aqueduct, fourth ventricle, foramen of Lushka and foramen of Magendie and subarachnoid space. Yes, Charan. Good. Yes. Okay, two foramina. Okay. So all of you write all the foramina. Right, foramen of Monro. देखो एक मुनरो है ಒಬ್ಬ ಮುನ್ರೋ ಇದ್ದಾನೆ ಮುನ್ರೋ ಆದ್ಮೇಲೆ we have someone known as Sylvian and we have Lushka and Magendie. So write this in chat box. This is very confusing in exam. That's why all of you write in the chat box Munro, Sylvian, Lushka, Magendie. Keep writing guys. All four you write. Pratik Desai. So Shashank is writing. Very good, Shashank. Munro hai. You know, Colin Munro is a very famous cricketer. Okay, New Zealand cricketer. Sylvester, Sylvian, Lushka. Okay, Magendie, fine, है ना? याद रहेगा शायद, है ना? Yes, Munro. Likit, write everything. All the foramina. All the name of the foramina. Sylvian, Lushka, Munro, Magendie. Good. Well, this is about the question number 4, most commonly asked. Then comes is your frontal lobe. Okay. So frontal lobe, there are 4 lobes as you know. Frontal lobe, the main function is, so the personality. The personality is because of frontal lobe. The question asked, so frontal lobe are the important sulcus and gyri. So this is very important diagram. So all of you go through this. So frontal lobe, parietal lobe, occipital lobe and temporal lobe. So frontal lobe, personality, behavior, emotions. Parietal lobe, intelligence. Occipital lobe, what is the function of occipital lobe? Occipital lobe function. So occipital lobe function is vision. Temporal lobe function is temporal, auditory pathway, one function you can remember. Then between the frontal lobe and parietal lobe we have central sulcus, the superlateral surface, and we have posterior ramus of lateral sulcus as well, pre-occipital notch, parieto-occipital sulcus. So this is very important diagram. So they can ask you 3 marks question. Superlateral surface of the cerebrum, or sometime they can ask you medial surface of the this is medial surface of the cerebrum. Okay, you need to write all this. Okay, frontal lobe, parietal lobe, occipital lobe, temporal lobe, central sulcus, parieto-occipital sulcus and pre-occipital nodes. If you write this diagram, you'll get 3 out of 3. So this is important. Okay, occipital vision memory. Good, good, good answer. Good man. Good, good. Charan, Charan, excellent. Very good. I'm happy. Happy. Chalo. Next. Next important question is okay. And one more MCQ, very commonly asked in anatomy, the functional area of cerebrum. So one very commonly asked is primary visual area. Primary visual area, that is 17, 18, 19. So if I write in the chat box, 17, 18, 19, primary visual area. Write in the chat box, primary visual area, 17, 18, 19. Okay. 17 basically and 18, 19 basically visual association area. So vision basically 17, 18, 19. Okay. So you can remember there are 17 eyes. 17 eyes are there, something like that. Then speech, Wernicke area, and we have Broca's area as well. So primary motor area, question asked in the exam. Primary motor area 4. Primary sensory area 312. 312. Premotor area, that is 6. 6. Broca's area, that is 45. So 45, that is the Broca's area. Auditory area 41, 42. This is asked once in the exam. All the important functional areas of the cerebrum. 17, 18, 19, very, very commonly asked. Okay. Yes. Then one more very important visual image, that is diagram. Corpus callosum. Corpus callosum. Okay. What are the 4 parts of corpus callosum? What are the 4 parts of corpus callosum? Can anyone answer? Corpus callosum. There are 4 parts, right? What are the 4 parts of corpus callosum? So this is cerebellum, and this is your brain stem, midbrain, pons and medulla, right? What are the 4 parts? Charan, are you there, Charan? Nagraj Pujari, Shashank Pujar, can I answer? What are the 4 parts of corpus callosum? Very important, guys, very important. You need to answer. So there are 4 parts. Basically, what are they? Body hai, one is body, and has a genu. It has a genu, right? Splenium and rostrum. Rostrum, splenium, body and genu. 4 parts are there. Okay, 4 parts. Very good. Aditi T. Rajesh. Aditi. Excellent answer, Aditi. Very good. So, genu, body, splenium, rostrum. So, all of you write. All the offline students, please write. Body, splenium, rostrum, genu. Body, splenium, rostrum, and genu. Write this. Tomorrow this can come in your exam. That's why some fun in between. Okay. Chalo. Next important question. Interior of right atrium. Interior of right ventricle. Left ventricle. Commonly asked. So one very commonly asked question is interior of right atrium. So in exam, you need to write this one. Okay, this diagram you need to practice. So it has a rough part, it has a smooth part, rough part and the smooth part. Rough part is having musculae pectinate, smooth part is there, and you need to mention fossa ovalis and limbus ovalis, AV node, tricuspid valve, and all you can mention. So this is again a 5 marks question, very commonly asked. You need to mention about SA node, crista terminalis. So labeling is very important. So this is interior of right atrium. So very, very important question from thorax. Okay. Then in one of the exam, the question asked about tetralogy of Fallot. Tetralogy of Fallot. You just go through that tetralogy of Fallot after the class. Brachial flexus. Brachial flexus, important question. I'm not going to discuss in detail about it. So brachial plexus, you need to write about the branches, cords, division, trunks and the root. Then cavernous sinus. This is very, very important. Cavernous sinus, very, very important diagram. Okay. We discussed many times in previous classes. So what are the features of cavernous sinus thrombosis? What are the contents of cavernous sinus? And this is the diagram you need to practice. So this is the pituitary gland, you can see there. Okay. So this is about the cavernous sinus. And one more very important question, that is middle ear. Label diagram of boundaries of middle ear. Boundaries of middle ear, I said in previous class, it has 6 boundaries. What are 6 boundaries? Superior, inferior, lateral and medial, anterior and posterior. Like a matchbox. It has 6 boundaries. 6 boundaries. Yes, Felix. Felix is answering well. Felix, very good. You are answering well. I am very happy about it. So this completes your all 10 questions. So wish you all the best. Wish you all the best for upcoming exam. Don't leave any question. So go inside the examination hall with the positive mindset. Don't discuss anything outside the examination hall. Go around within 8:30. Okay, and go through the paper in the beginning for 5 minutes. Go through the long essay, go through the reasoning questions, go through the short essays and MCQ. Then you can start writing. Okay. So this is about the today's class. I hope many questions do come from previous 5 classes. Any doubt you can ask me. I'll be there for next 10-15 minutes. Rest you can read. Yes, Shashank, all is well. I can do it. All is well. I can do it. You can do it. We can do it. Yes. Yes, Shashank. Charan. Right. All is well. I can do it. Where are you, Charan? Are you there? Likit. Likit, Charan. Pratik. All is well. I'll do my level best. Or I can do it. I can pass. I will pass this time. I will pass. Okay. Where are you, Charan? Charan, are you there? Upper limb. Okay, came. All is well. All is well. We can do it. Yes, we can do it. I can do it. Great. So this is what positive attitude that matters the day before the exam. Yes, Likit, you will definitely pass. You will definitely pass. You don't worry. So, and don't leave any question blank. Okay, upper limb KM. Okay, expected questions in upper limb. But upper limb is very simple, I think. Very simple. Okay, no problem. So upper limb. Upper limb. Okay. Okay, Aditi T. Rajesh. Wish you all the best. All the best. Do well. Okay. So one important question. Let's see 10 important questions. 10 important questions. 10 important questions. Short essays. Okay. Short essays. Short essays. So as usual, brachial plexus is very important. As you know, brachial plexus frequently asked in the exam. So brachial plexus. Brachial plexus. Air palsy. Klumpke palsy. Very commonly asked. Then radial now, the favorite of examiner. Radial now, the favorite of examiner. Or posterior introsius now, radial now, honeymoon palsy, Saturday night palsy, crutch palsy, very frequently asked. Then comes his median now. Median now, especially carpal tunnel syndrome. Okay. Then comes his your clavicle. Clavicle. So clavicle is frequently asked. Either surfaces, attachments, and peculiarities of clavicle. Peculiarities of clavicle. There are 8 peculiarities very commonly asked. Okay. Then shoulder joint. Shoulder joint is favorite of examiner. Shoulder joint. Especially articular surfaces. Articular surfaces. Dislocations. Movements. Flexion, extension, abduction, adduction, all this movement, shoulder joint, that is important. Then comes is your cubital fossa. Once this is asked, cubital fossa and the boundaries. Okay. Median cubital vein, very commonly asked. Applied anatomy of that. Median cubital vein. Median cubital vein, frequently asked. Okay. Yes, KM. Sometime there can be scapula. Scapula also asked once. Scapula. Palmar arches. Palmar arch. Superficial palmar arch, deep palmar arch. Asked once. Okay. Rotator cuff. Rotator cuff. Frequently asked. Sits is the mnemonic. Sits. Okay. So elbow joint, no, not that important. Wrist joint, not asked one. One more asked is the radioulnar joint. Okay. So radioulnar joint. Radioulnar joint. Radioulnar joint. Inferior radioulnar joint. Asked once in the exam. So I think shoulder joint is important. Okay, all these are important. Radial now, all these nows basically very important. Then carpal tunnel syndrome, thenar, hypothenar muscles, 3 marks question. All these are important. Okay. Yes. So okay, is it clear? KM. KM. Okay. Are you there? KM. Okay. Salman Akhtar is asking, sir, how to pass? Salman Akhtar. So how to pass? The first thing is the knowledge, definitely. Second thing is the confidence, and the third thing is attempt all questions in exam. Attempt all questions in exam. So this is the very important component. Yes, brachial artery, axillary artery is also asked. Oh, okay. Long thoracic now. Yes, I forgot to tell you. Long thoracic now is commonly asked. That is basically winging of scapula. Winging of scapula. Winging of scapula. Important. Yes, axillary artery, brachial artery. Okay. Landsman darcy. Okay. Deltoid. Yeah, I forgot to tell you about deltoid. Okay. So deltoid is one more important question, guys. Deltoid is one more important question. Especially structures under the cover of deltoid. Structures under the cover of deltoid, nerve supply, the actions, and all. Okay. So deltoid once asked once. Okay. So this is about the important questions in upper limb. So, I thought upper limb is very easy. So that's why I discussed neuroanatomy, head and neck in last 4 or 5 days. Okay. Cole's fracture, no, no. Jada. Cole, okay, Smith fracture, that's fine. Okay. Salman Akhtar. Any other doubt? Any other doubt, guys? Any other doubt? So, how important a diagram? Diagrams are very important. We discussed many in our classes, important diagrams. Yes, clavipectoral fascia, clap is a mnemonic. So, what are the structures piercing clavipectoral fascia, clap, cephalic vein, and all? Yes, clavipectoral fascia. Yes. Okay. So, that's it about the today's session, guys. The final words. Final words. Don't stress. Don't stress. I know lot of stress in your mind right now. Lot of stress. I can imagine the amount of stress in your mind right now. So don't stress. Don't stress. Do your best. Okay? Do your best. See, our expectation is very high. Sometimes the expectation creates anxiety. Do your best. ನಿಮ್ಮ ಹತ್ರ ಎಷ್ಟಾಗತ್ತೋ ಅಷ್ಟು ಚೆನ್ನಾಗಿ ಮಾಡಿ. Do your best. And forget the rest. Forget the rest. Don't worry about the marks. Don't worry about the percentage, distinction, gold medal. Okay, if you get that is fine. But don't worry, the primary goal must be to pass exam. To pass exam. Your goal must be at least 50 out of 100. 50 out of 100, sir. 50 is my target. If I get 50, I'll be very happy. 60, very happy. 70 also very happy. But 50 is needed. So the 50 out of 100 make me happy, make your parents happy, make your teachers happy, everyone happy. So 50 out of 100 is my target. Okay, Salman Akhtar, getting my point. Don't worry, don't worry, don't take unnecessary stress. So wish you all the best once again. And tomorrow you'll be having a marathon session on the paper one discussion, and there will be a discussion of most important questions related to anatomy paper 2 as well. Thank you all. See, 50, it's better to target 50. People say 40 also. 50 should be your target. Okay. Kirti Kumar. Thank you, Likit.